Good morning, everyone. Thank you for taking the time to join me today to learn about the basics of Medicare. If you can hear me, could you please raise your hand by clicking the hand icon so that I know that I'm being heard before we begin? Okay, great. Thank you so much. Okay, we have a lot to go over today. So we have a short amount of time. I only designated an hour today. So I'm going to leave questions for the very end. You can go ahead and type them in the questions section on the webinar. If we run out of time, please still ask your questions, and I'll be happy to email you once the webinar is over with your answers. I'd like to introduce you to our Medicare offering staff here at URL. I'm Christy Wilbert, the Director of Medicare Marketing. My co-director is Karen McDaniel. She's the Director of Operations and Compliance. And then our two beautiful agent support specialists, Janine Raycup and Alyssa Balcom. We may look young, but together we have over 35 years of insurance experience, so a lot of knowledge in our group. For those of you that aren't familiar with URL, we're a marketing organization that promotes and distributes insurance carriers and their products to licensed agents. We're dedicated to providing sales training, tools, and networking opportunities to our agents with our exceptional staff that specializes in each line of business, and we're highly trained on all the companies that we represent to provide you fast and accurate sales and marketing support. URL's goal is to help you grow your book of business, and our motto is we're in the people business. The lines of business that we represent here at URL are life markets, annuities, individual and group health, that includes ancillary products, employee benefits, and of course Medicare offerings. And feel free to visit our website to review all of those departments in more detail and staff. We have just recently introduced our Gemini program. This is a new thing we've developed. It's a program that's encouraging our agents to write all their business here with URL. In return, we're offering additional bonuses and incentives. Very simply, if we don't have the carrier that you need to place business with, there is no obligation or expectation for you to write business with URL. Here are some of the incentives in the Gemini program. They're not all listed here. It's just a teaser for you. For example, our Medicare bonus this quarter is $25 in addition to commission per Medicare Supplement application. Why sell Medicare? The very simple answer is opportunity. 10,000 people turn 65 every day. There's 78 million baby boomers that will become eligible over the next 20 years. 49 million current Medicare eligible in the U.S. 3.9 million Americans will turn 65 this year. 73% of Medicare eligible do not have a Medicare Advantage plan. I don't want to go over all of these with you, but there's great commissions and incentives in Medicare. It's the fastest growing insurance industry, and there's great cross-selling opportunity. If you're in life markets, if you're in annuities, you're talking to the same people that need Medicare. So if you're not interested in selling Medicare, you simply come across it now and again, and you want to simply refer business, you're welcome to do that. We've just developed this program. I have the flyer available in the handout section on the webinar for your download, explaining how the process works. Simply, you refer the business to us, and we pay you a one-time referral fee. Gemini agents do receive more than the $75. Okay, the Medicare 101 presentation, it was created by CMS and approved for you to use in selling when you're with a client. So feel free to download that from our website, or you can simply download it from the handout section. Again, it's with that easy Medicare flyer. At this time, I'd actually like to take a poll. So I'm going to get that started here to see who is currently selling Medicare and they're just looking for a refresher, or if you've never sold Medicare. You can simply select yes or no on that, and I'll leave it up for a little bit here. Okay, so this is the beginning of the CMS-approved webinar. So Medicare currently provides healthcare insurance for 54 million U.S. citizens. That's approximately 1 in every 6 Americans. Medicare is health insurance for generally 3 groups of people: those who are 65 and older, people under 65 with disabilities, or people of any age who have end-stage renal disease, such as kidney failure. To get Part A and B, you must be a U.S. citizen and lawfully presented in the United States. So the Centers for Medicare and Medicaid Services, or CMS, is the administrators for the Medicare program. They do all of the marketing guidelines and regulations to selling and marketing Medicare, and it's the big reason that we have Karen McDaniel on part of the staff. So she's a great resource if you ever need to use her. Parts of Medicare. Part A, hospital insurance. Your Part B is medical insurance or doctor's insurance. Part C is a separate plan altogether, and that's the Medicare Advantage plans. They work like your HMO PPOs that people are used to. We'll go over those in better detail. And then Part D is your prescription drug coverage. There are 2 ways to get Medicare. Your original Medicare A and B, and then you have the option to buy a Medigap or a Medicare Supplement policy that fills in the gaps of original Medicare, in addition to a Part D prescription drug plan. Or your other option is to go with a Medicare Advantage plan that works as the HMO PPO, and they usually include the drug plans. So it's an all-in-one plan. If you're already getting Social Security benefits, you'll automatically be enrolled in Medicare Part A and B without an additional application. You'll get your initial enrollment period package, which includes your Medicare card and other information, about 3 months before you turn 65 or 3 months before your 25th month of disability benefits. So you would need to be on disability for 2 years, and on that month after your 2 years is up, you would receive your package. If you're not getting retirement benefits from Social Security or a Railroad Retirement Board, you'd need to sign up for Medicare, and you can do that on socialsecurity.gov or your local Social Security office. When you have original Medicare, you use your red, white, and blue Medicare card when you get your health care services. The Medicare card shows the type of Medicare coverage, Part A and Part B, that you have and the date that they were effective. If you get your Medicare card and you don't want to enroll into Part B, you simply follow the directions on the card. If you can see it says, I don't want medical insurance, you just check there, sign it, and send it back. If you aren't getting Social Security or Railroad Retirement Board benefits at least 4 months before you turn 65, you'll need to sign up for Part A and Part B, and you should contact Social Security, which we basically are done. Your first and most important chance to enroll in Medicare, especially Part B, is during your initial enrollment period. That lasts for 7 months. It's 3 months before you turn 65, the month you turn 65, and then 3 months following your 65th birthday. The first time you can enroll in Medicare is at the beginning of your IEP. Again, your IEP begins 3 months before the month and then 3 months after you turn 65. These delays are required by law. If you don't enroll in Part B, you may have to pay a lifetime premium. Sorry, we had a little bit of error there with my computer. I hope we're up and running okay now. If you didn't sign up for Part B during your initial enrollment period, you can enroll during the general enrollment period. For most people who don't enroll during their initial enrollment period, this is their only chance to enroll, which it begins January 1st and ends March 31st. And your coverage would not begin until July 1st. If you wait more than 12 months, you'll be subject to a penalty, which is 10%. The other way to enroll is during a special election period for Part B. There are special circumstances that get you this qualification. One would be if you are currently in group plan health coverage. For all the months you're eligible to roll in Part B but didn't. For most people, this means you've had group health since you turned 65. So say you are retiring or your group plan ends or you just decide Medicare is cheaper. When you cancel your group health plan, this will automatically give you 63 days to enroll into Part B and a Medicare plan. Okay, check your knowledge. There are some decisions you'll need to make about your Medicare coverage, including the following. Do I want original Medicare or should I consider Medicare Advantage plan? Should I take Part A or Part B when? Do I need a Medigap policy? What about Part D? What do I need to do if I'm not retiring at 65? So these are all questions that you'll be getting from a beneficiary, so you should be prepared to answer those when you go on appointment. So which of the following best describes your initial enrollment period? Is it January 1st through March 31st? No, that is the general enrollment period if you missed your initial enrollment period. January 1st through February 14th, that's actually your disenrollment period, which we'll go over later. An 8-month period to sign up after employment ends, that's an SEP following leaving your group plan. So D is an enrollment period that becomes available to you when you first become eligible for Medicare, and that is the answer, D. Medicare Part A is your hospital insurance. It helps cover your hospital inpatient care, such as a semi-private room, meals, general nursing, hospital services and supplies. It also covers inpatient skilled nursing facility, which is, certain conditions. Blood is covered, certain inpatient health care, home health care, so a doctor that is coming into your home, you must be homebound for this, and then hospice care. Your doctor must certify that you're expected to live 6 months or less to have hospice covered. You usually don't pay a monthly premium for Part A. If you or your spouse paid Medicare taxes while working, this is sometimes called premium-free or free Part A. Federal Insurance Contributions Act is tax that you pay while you work. So that determines if you have a monthly premium or not, and that's determined by Social Security. There is a penalty if you don't enroll when you're first eligible. Again, it's 10% every 12 months. This slide shows the cost you're responsible for if you only have original Medicare Part A. So I want you to focus mainly here on the Part A deductible, which is $1,288 per benefit period. This is not a per year deductible. People have that mistaken sometimes, so this is a big selling point towards offering a Medigap or Med Advantage plan. This is what benefit period means. It's a benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you haven't received any inpatient hospital care for 60 days in a row. And that's what makes you pay your deductible. So if you spend 5 days in the hospital and then you go into a skilled nursing facility for 20 days and then you return home and you are home for 60 days or 85 days or anything. Once you go back to the hospital again, it could be for the same circumstance that bothered you the first time or something completely separate, you would still have to pay that $1,288 again. And there is no maximum or limit of the amount of times you would pay that deductible in a year. If you're receiving Social Security or Railroad retirement benefits at least 4 months before you turn 65, you'll be automatically enrolled, which we said. You can no longer contribute to your HSA. So if you have that through your group employer coverage, you would want to stop contributing to that. You would want to contact your benefits coordinator. Usually it's about 6 months before. But you can withdraw that money from your HSA after you enroll into Medicare to help pay for medical expenses like deductibles, premiums, co-payments. If you contribute to your HSA after you have Medicare, you'll be subject to a tax penalty by the IRS. So that's why we want you to stop contributing. Medicare Part B helps cover medically necessary outpatient services and supplies, such as doctor services, outpatient medical and surgical services such as x-rays and stitches, laboratory, blood tests, analysis, screenings, your durable medical equipment like walkers, diabetic testing supplies, and preventative services such as your yearly exam, screening, shots, managing a health problem. So you pay a premium for Part B each month. Most people who get Social Security benefits will continue to pay the same Part B premium amount as they paid in 2015, which is $104.90. This is because there wasn't a cost of living adjustment for 2016 Social Security benefits. In 2016, the standard Part B premium amount will be $121.80 or higher depending on your income. Those who pay the standard premium, $121.80 in 2016, include those in one of these 5 groups, which is they enroll in Part B for the first time this year. They don't collect Social Security benefits. They are directly billed for their Part B premiums. They have Medicare and Medicaid who helps pay their premiums, or they have modified adjusted gross income as reported on their IRS for the past 2 years. And they're being billed by IRMA. And that's because they make more money, which we will show the chart here. This chart shows the Part B premium based on your income. So if your income changes, every 2 years, maybe you were making more when you worked and then you retired and you claimed a much lower income on your IRS than you have in the past, you can, or your W-2, you can call Social Security and have them reevaluate and adjust your Part B premium. So in addition to premiums, there are other costs you pay in Original Medicare. This is what you pay for the 2016 Part B deductible. It's $166. So if you have Original Medicare, you pay the Part B deductible, which is the amount a person must pay for health care each calendar year before Medicare begins to pay. This amount can change every year in January. This means that you must pay the first $166 of your Medicare-approved medical bills before Part B starts to pay for your care. You also have a 20% coinsurance for Part B, but some of the preventative services, such as your annual doctor's visit, mammograms, flu shots, there's no copay or coinsurance for those. If you're already getting Social Security benefits, you'll be automatically enrolled in Part A and B. You'll get your initial enrollment package, which we discussed. Part B premium is usually deducted from your monthly Social Security, railroad retirement, or federal retirement payments. People who don't get a retirement payment, this bill can be paid by credit card, check, or money order. And there are different ways you can pay it, monthly, quarterly, annually. You must have Part B if you want to buy a Medigap, you want to join a Medicare Advantage plan, if you're eligible for TRICARE for life, if your employer requires you or your spouse to become a member because you have 20 or less employees in your office. And just for knowledge, veteran benefits are separate from Medicare, so you can have both a VA policy and Medicare. If you don't take Part B when you're first eligible, you'll have to pay a penalty of 10% for each full 12-month period that you could have been enrolled but you weren't, except in those special circumstances. If you don't take Part B when you're first eligible, you may have to wait to sign up, which is that general enrollment period from January 1st through March 31st each year, and then coverage again is effective July 1st. If you're covered by group or employee coverage, you may want to delay Part B just like we said in the beginning, you just check the back of the card and send back. This means that you're rejecting Part B because you have credible coverage and it's not necessary at this time for you to carry it. Later, if then you are leaving the group plan, retiring, or so forth, you will get that special election period that we discussed. You have 63 days to enroll in Part B without the penalty. Oh, I'm sorry, you actually have 8 months when you're retiring and leaving group coverage. Okay, check your knowledge. Which part of Medicare covers diabetic testing supplies? Part A, B, C, or D? The answer is Part B, which covers diabetic supplies. Which of the following best describes what Medicare Part A, hospital insurance, covers when the services are medically necessary? Your first 3 pints of blood, emergency room visit, outpatient prescription drugs, inpatient hospital care. It's D, inpatient hospital care. Now let's talk about one way to help address some of the costs associated with original Medicare coverage. A Medigap policy is health insurance sold by private insurance companies to fill gaps in original Medicare coverage. Medigap policies can help pay your share, coinsurance, copayments, or deductibles of the cost of Medicare covered services. Some Medigap policies also cover certain benefits original Medicare doesn't cover. All Medigap policies cover a basic set of benefits, including the following. All plans cover 100% of Medicare Part A, coinsurance, and hospital, an additional 365 days after Medicare benefits are used up. In addition, each Medigap plan covers different benefits. As you can see, the plans are, different compared to the letter of the plan. Plan F covers the most, and then Plan C, and then Plan G, and so forth. The plans are uniform from carrier to carrier. The only difference is price, and some carriers even offer special features such as silver sneakers or silver and fit. You need to have original Medicare to get a Medigap policy. Medigap doesn't work with a Med Advantage plan. If you have other coverage that supplements Medicare, such as a retiree coverage, you might not need a Medigap. You need to consider whether you can afford Medicare deductibles and copayments and weigh this against how much the monthly Medigap premiums cost. Medigaps tend to be a little pricier than the Med Advantage plans. Reason being is that they do provide a lot of coverage. They provide peace of mind, lowers your risk of catastrophic loss. If you have poor family history of health, you have pre-existing conditions, the policies are guarantee renewable. Beneficiaries can enroll directly on Medicare.gov, or they can complete an application with an agent. We have all applications available on our website for each carrier that we represent for our agents' convenience. Usually the best time to buy a Medigap policy is during your open enrollment period. It begins when you're 65 or older and enrolled in Part B for the first time. You must also have Medicare Part A to have a Medigap policy, and you have 6 months to enroll with a guaranteed right to buy a Medigap policy. This means that the Medigap carrier cannot refuse to sell you any Medigap policy because you have that guaranteed right to purchase. This is only in your open enrollment period, which is the 6 months after you get Part B. And you're not subject to any pre-existing conditions, or you can't be charged more because of past or present health problems. When selling a Medigap policy, explain the differences of each plan letter to the beneficiary. The grid that I had up earlier, a lot of agents use that to show the beneficiary, and you can decide which coverage is best for them. We have a great quoting tool on our website at urlinsgroup.com showing plans side by side, and you need to gather just a few pieces of information to run a quote. Their zip code, county they live in, their age, if they use tobacco, the plan letter they're interested in, and then the effective date of their policy. So a Medigap policy may fill which coverage or cost gaps? Part A and B deductibles, Medicare enrollment penalties, prescription drugs, or Medicare premiums? The answer is that they're going to cover your Part A and Part B deductibles. Medicare Part D is Medicare prescription drug coverage. Part D coverage is provided through Medicare, prescription drug plans, and Medicare Advantage plans with prescription drug plans attached. Medicare contracts with private insurance companies that offer prescription drug plans to people with Medicare. Everyone with Medicare can get a Medicare prescription drug plan by enrolling in the plan. You may have to pay a penalty if you join later, just like the Part B, if you have Part A and B. Each plan has a formulary. It's a list of covered drugs. Costs will vary depending on the plan. They tier the drugs 1 through 4. Some carriers might have a drug at Tier 1, and the same drug can be a Tier 2 on another plan, so there's a different out-of-pocket expense. So you will pay a cost sharing of the prescriptions when you pick them up, so you'll have your monthly charge for the plan, and then you'll have your deductible or co-payment when you pick up the drug. If you do have a higher yearly income, you might also have to pay a Part D IRMA, income-related monthly adjustment amount. If you have to pay this extra amount for Medicare Part D, the amount will be deducted from your Social Security or Railroad Retirement Board benefit, or you'll be billed monthly by Medicare. If you get a bill for Part D IRMA, you pay this amount to Medicare, not your Part D plan. Anyone who has Medicare Part A and or Part B is eligible to join a Medicare drug plan. You must live in the plan service area to enroll, and you can't live outside the United States or be incarcerated. You can join a Medicare drug plan when you first become eligible for Medicare during your initial enrollment period, which is the same as we discussed before, 3 months before you turn 65, the month you turn 65, and 3 months after. The annual enrollment period is October 15th through December 7th. Any eligible person can join, switch, or drop a Medicare drug plan during this time. It's the same as a Med Advantage plan. Each year you have a chance to make changes during that time also, and your coverage begins January 1. There's also special enrollment periods for the prescription drug plan. An example would be if you permanently move out of the plan service area, if you lose your credible coverage, like you're leaving your group plan, if you qualify for extra help because of low income. A beneficiary can enroll directly using Medicare.gov again, or you complete an application with an agent, and URL does have all of these applications for the carriers that we represent on our website as well, and we do have enrollment kits available in our office that you can pick up or we can mail to you as well. People who have another source of drug coverage through a former employer, for example, may choose to stay in that plan and not enroll in a Medicare drug plan. If you have other coverage and it's at least as good as Medicare prescription drug, it's called credible coverage, and you won't have to pay a higher premium if you later join a Medicare drug plan. So your other plan will notify you and let you know if your coverage is credible. It should say on your declarations page. This notice will explain your options, and you can contact your plan's benefits administrator for more information. What are Part D options for people with Medicare? There's the standalone prescription drug plan, that's one. Medicare Advantage prescription drug, that is another one. Prescription drug discount card, well, that's not one. And then both A and B, so that's your answer D. It's July. You enrolled in Medicare last year, but didn't enroll in a Medicare drug plan. Generally, when is your next chance to enroll in Part D? June, May, October, or December? And that would be C, October, which is the beginning of open enrollment, October 15th to December 7th. Medicare Advantage plans are health plan options approved by Medicare and run by private insurance companies. MA plans are part of the Medicare program. They're just another way to get Medicare coverage. So Medicare pays the plan a certain amount for each member's care. If you join an MA plan, you may have to use a network of doctors or hospitals. There's 6 types of MA plans. There's the HMO, PPO, private fee-for-service, special needs plans for people that are on Medicare and Medicaid, point of service, and Medicare savings accounts. If you join a Med Advantage plan, you're still in Medicare with all the rights and protections. You still get those services covered by Part A and B, but MA plans cover those services instead. So your bill would go to the carrier, not, Social Security. May choose a plan that includes prescription drug coverage, and benefits and cost sharing may be different. May choose a plan that indicates extra benefits such as vision or dental offered at the plan's expense. So that's not covered by Medicare, and you usually won't find any vision or dental benefits in a Medigap policy. You can join a Medicare Advantage plan when you first become eligible for Medicare during the initial enrollment period, which again begins 3 months and immediately before your first entitlement to both Medicare Part A and B, or during the year's open enrollment period, or you have a special election period. You can only join one MA plan at a time, and enrollment is a plan is generally for a calendar year. You can switch to another MA plan or back to original Medicare during open enrollment period, which again is October 15th through December 7th. And your disenrollment period, if you belong to an MA plan, you can disenroll or switch back to original Medicare from January 1st through February 14th. If you go back to original Medicare during this time, coverage under original Medicare will take effect on the first day of the month following the date on which the election or change was made. So if you made the change on your last day, February 14th, it would become effective March 1st. There are things to consider when deciding if you want to join a Medicare Advantage plan. You must have Part A and B to join. You must have comprehensive coverage. Plans are subject to network, so you want to make sure that your doctor is in network. If you do have an HMO, you need to make sure that you get referrals to see a specialist. You still are responsible for your Part B premium, which is monthly to Social Security, and you do only have certain time periods where you can join or leave the plans. This chart displays a side-by-side comparison on how Medigap policies and Medicare Advantage plans are different. As you can see, they're showing here that there's a lot of similarities, but they both are offered by private companies. Medigap is offered by the state. Med Advantage is offered federally. Their oversight is federal. Medigap works with your original Medicare. Med Advantage plans are on their own with the insurance carriers. Medigap covers the gaps in your original Medicare, and Medicare Advantage is, covering things separately and adding additional coverage. Both you have to have Part A and Part B, and you have to pay a premium for both plans. So which of these offers at least the same benefits of Medicare Parts A and B? I don't really like this question. The answer is Medicare Advantage plans. They offer all parts of A and B covered services, but they add additional benefits which are not covered by original Medicare, like vision and dental. Which Medicare option is not available to most people with end-stage renal disease? Medicare Advantage plans, employer coverage, Medicare prescription drug plans, Medicare Part A and Part B. The answer is A. If you have end-stage renal disease, you cannot get a Medicare Advantage plan. This chart lets you compare original Medicare and Medicare Advantage plans side by side. If we go down original Medicare, covers Part A and B, provides this coverage directly. You have your choice of doctors and hospitals. There's no network. Generally, you or your supplemental coverage pays deductibles and coinsurance. and you usually pay a monthly premium for Part B. For Medicare Advantage plans, it covers Part A and B benefits. There may be additional benefits. Sometimes they call Medicare Advantage plans a Part C, coverage provided by private insurance companies approved by Medicare. In most plans, you need to use plan doctors, hospitals, other providers, and you may pay a monthly premium in addition to your Part B premium, along with a copayment, coinsurance, and deductibles per plan. And this displays a side-by-side comparison covering original Medicare and Med Advantage plans and describes a summary for each. So original Medicare, doesn't have drug coverage. Med Advantage plans usually have drug coverage included. Supplemental coverage with original Medicare, you can buy a Medigap or a Medicare supplement policy. For Med Advantage plans, you cannot buy a Medigap or a supplemental policy with those. Medicare isn't a part of the health insurance marketplace. If you have a Medicare Part A only, you're considered to have minimum essential coverage. If you have both Medicare Part A and Part B, you're also considered covered. You wouldn't need a health plan from the marketplace. If you have Part A Medicare, you don't have to do anything related to the marketplace. No matter how you get Medicare, whether through original Medicare or Medicare Advantage plan, you won't have to make any changes. The marketplace doesn't offer Medicare supplement insurance or Part D plans, and it's actually against the law for someone who knows that you have a Medicare to sell you a marketplace plan because you don't need it. You can keep a marketplace plan to cover you after you're eligible for Medicare. You can then cancel the marketplace plan once your Medicare coverage starts. So once you're eligible for Medicare, you have your initial enrollment period to sign up at 3 months before, the month, and then 3 months after. You may have Medicare and marketplace coverage concurrently only if you had your marketplace coverage before you had Medicare. And there's no correlation between the two. So if you have a qualified health plan and Medicare, it's not really benefiting you. You need to be aware of this. If you're entitled to Social Security disability insurance, you may qualify for Medicare. However, there is a 24-month waiting period before Medicare coverage can start. During this waiting period, you can apply for coverage in the marketplace. So you can find out if you qualify for Medicaid or for premium tax credits that lower your monthly marketplace plan premium and cost-sharing reductions that lower your out-of-pocket costs. So your Medicare card will be mailed to you about 3 months before your 25th month of disability benefits. You can choose marketplace coverage instead of Medicare if you would have to pay a premium for Part A. So you can drop your Part A and Part B and just have marketplace coverage instead. Only have Part B and would have to pay a premium for Part A, you can drop Part B and get a marketplace plan. If you have a medical condition that qualifies you for Medicare, like end-stage renal disease, but haven't applied for Medicare coverage, you can have a marketplace plan and aren't yet collecting Social Security, retirement, or disability benefits before you're eligible for Medicare, you can have a marketplace plan. You can enroll in the individual marketplace instead of Part B and get Part B later using a special enrollment period. Is that true or false? That is false. You can only have employer group coverage and then disenroll in that and have a special election period into Medicare. An individual marketplace plan does not count as credible coverage according to Medicare. There are programs available to help people with limited income and resources pay their health care or prescription drug plans. These include Medicare savings programs, Extra Help, Medicaid, and the Children's Health Insurance Program, or CHIP. And you can apply for these programs if you have limited income and resources by calling Medicare directly. So if you want to help a client, you would just call them you would call Medicare with them in your office to see if they qualify. Medicare and Medicaid are different in the following ways. While Medicare is a national program that's consistent across the country, Medicaid consists of statewide programs that vary among the states. Medicare is administered by the federal government. Medicaid is administered by state governments within federal rules. Medicare eligibility is based on age, disability, end-stage renal disease, and Medicaid eligibility is based on income and resources. While Medicare is the nation's primary payer of inpatient hospital services to the disabled, elderly, and people with end-stage renal disease, Medicaid is the nation's primary public payer of acute health, mental health, and long-term care services. Medicare Savings Program. This program provides help from Medicaid paying Medicare costs, including Medicare premiums, deductibles, and/or coinsurance. It often has higher income and resource guidelines than full Medicaid. So this chart shows you the income limit and which program helps you pay your premiums. It's a good reference to keep. There are a variety of resources available to help you learn more about Medicare. These are a few of them. We use Medicare.gov on a regular basis here in the office. It's a great source of reference. There's a search screen at the top. You literally type in your question and it will bring up a few websites to get you the answer. I use it regularly, so I highly recommend browsing on it. CMS.gov has a great amount of research out there. We use a ton of their flyers and marketing materials since they're approved, and they're usually generic where you can just plug in your agency information and then you don't have to get them checked for compliance, which sometimes can take up to 6 months for approval. Here are some key points to remember. Medicare is a health insurance program. It doesn't cover all of your health care costs. You have choices in how to get your coverage. There are programs for people with limited income and resources. It's important to know when you need to take action. Your decisions affect the type of coverage you get. So it is really important that they have agents to go over everything with them. It's a lot to remember. It's a lot for us to remember. It's a lot for the agents to remember. So when you're working with the elderly, we really need, good agents out there teaching them and explaining to them what they're buying. And there's a help available to you if you need it. We're here to answer any questions that you have, even if you're in the middle of an appointment. Okay, and we're done. So I do have some time to answer some questions, so I'm going to go in here. Okay, so I know I see a lot of you were telling me you couldn't see my screen, so I apologize for that. We did get that fixed halfway through. Are there any more questions about the presentation that I can answer at this time? How do you verify a person has Part A and Part B when enrolling in a Medigap plan? You would want to ask to see their Medicare card. They should have that with them at all times. It's just like an insurance card. And right on it, it will say Part A effective, Part B effective, and give you dates. The best way to get trained to sell Medicare, that would be continuing taking our webinars. I have some information that I can send you as far as there's a Medicare and You book and how to enroll into the best Medigap policy for you. I can send those to you. I'd be happy to do that. We do have an in-house training coming up on March 30th for agents that are local. It will be directed towards marketing and Medicare compliance with Jim Penman from UHC AARP and also Karen McDaniel here in our office. It's asked if we can get a copy of the training. If you look into the handouts that's right there for you, there is a copy of the slideshow that I just did for you. We also are recording the webinar, so that will be listed on our URL YouTube page if you want to review it at a later time. If a client has a Medicare Advantage plan and goes in the hospital 3 times a year, will they have to pay this deductible 3 times? And if they have a Med Supp plan, they pay 0 and the company pays it not client. That's correct. Well, Medicare, original Medicare has the $1,288 deductible. So if you have original Medicare and you're going to the hospital 3 times in the year, you will have to pay that deductible if you're going over that 60-day window each time you're out of the hospital. If you have a Med Advantage plan, you'll be subject to the copay or co-insurance in the plan, and each plan is different. Some might be, $250 per day for 5 days, for an example. A Medigap or a Medicare Supplement policy, there would be no deductible for the hospital stay. So that shows you why Medigap is more expensive. They do cover the majority of the copayments, deductibles, and out-of-pocket expenses. Can you enroll someone over the phone? You can not. We do sales over the phone here when we do the referral program. You do have to get a special training and certification. It's a telemarketing certification, or you can simply just have your appointment over the phone and then mail them the application. I do want to warn you that compliance, you can't cold call for Med Advantage plans, but you can for Medicare Supplement plans. So you do want the prospective client to call you if you're going to be discussing Medicare Advantage plans. Do you need to be appointed with each company to sell supplement plans? Yes, you need to be contracted with each carrier in order to sell, or you will not be receiving commissions. How can you simply certify for all Advantage plans? There's no way to certify for all Advantage plans. There is an AHIP exam that you would want to take if you're going to be contracting with Med Advantage plans. That can be found on the AHIP website, or Aetna Coventry does it for a discounted rate. That exam would be the first one you would want to take. It's nice training. It's 5 modules, and then you take, I believe it's a 150-question test at the end. They give you 2 hours to take it. It's open book. And then for each carrier that you contract and want to sell, which you don't need to have a ton of carriers available in the area that you're going to be writing. Usually there'll be a top 2 or 3 in your area. So then you would take those carriers' certification quizzes. They're much smaller. You just read about the product, and they just want to know that you're comprehending what you're reading before you're able to sell their product. And then once you're contracted with URL through the carrier and then certified to sell, you may sell the Medicare Advantage product. Some Medigap policies do not require that training, just so that you're aware of that. So they're much easier to get contracted and much faster in order to sell. If a person qualifies for Medicare due to Social Security disability, but is on their spouse's employer health insurance policy, do they have to sign up for Part B? No. If you're covered by employer benefits, you do not need to get Part B. And Karen McDaniel, my co-director, is telling me the AHIP's 50 questions, so I apologize. I misinformed you. Okay, well, thank you so much, everyone. I think I answered all of the questions. If I failed to answer any, please feel free to email me directly. My email is christyw@urlinsgroup.com, and I appreciate you and all that you do. Thank you.